As variant cases surge across the country, many healthcare experts say it's time to change the way we're vaccinating people. Now, they say it's time to shift the priority from older Canadians to essential workers. Canada is set for another big week of vaccine deliveries. More than 2 million doses are expected, including 1 million from Pfizer-BioNTech, 850,000 from Moderna, and more than 300,000 from Oxford AstraZeneca. And the Oxford AstraZeneca delivery is going to be the first to arrive in Canada from the global vaccine sharing program known as COVAX. Now, Canada has already contributed $440 million to that fund. That money has not only secured vaccines for Canadians, it also has gone towards buying doses for poorer countries. Canada could receive up to 15 million doses under that program. And the reason why I'm reading so quickly, folks, is because I really want to get to our next guest. Dr. Amanpreet Brar offers a really unique perspective because she is a general surgery resident with the University of Toronto, but she was also previously a warehouse worker. And this is so perfect. She's joining us from Brampton, having this perspective of both an essential worker in one way and an essential worker in another way. Dr. Brar, thank you so much for joining us.
Thank you so much, Natasha, for having me on your show today.
Absolutely. You know, I just clarified it for myself. You have been two very different kinds of essential workers. Tell me about the work that you did in the warehouse in the capacity of how difficult it would be if we were in the midst of a pandemic at that time.
Yeah, no, it's really interesting perspective for me because I almost feel like I'm on the other side, almost like a privileged essential worker now. Back when I was working as a temporary factory worker, as also a new immigrant in Canada, I had really no job security. I was waiting for phone calls every evening to see if I would be called to work or not the next day. And so I could imagine, even those times when it was pre-pandemic, if I was not feeling well, I was very reluctant to call in sick because I had no paid sick leave and I had no job security. And I really didn't want to be in the agency's bad books while I was struggling financially. So, I would always go to work. So there was no really option to stay at home. And so I could really see that playing out during the pandemic now as a physician, when I do really feel privileged that, if I do feel unwell or have even mild symptom, I'm able to call into work and take a sick leave. And on top of that, really get vaccinated as well. And so I really want to advocate for the unsung pandemic heroes that are actually equally essential, but their lives and health is sometimes not considered so essential.
Now, who would you put in that category, these unsung heroes who are also essential workers?
Precarious workers, talking about from manufacturing, warehouse industry, to as well as food processing, transportation, especially, the truck drivers who have been, crossing vaccinated borders while remaining unvaccinated themselves, taxi drivers, also essential workers, teachers who have been going to school. These are all really unsung pandemic heroes that have been frontline, putting their lives at risk and being really exposed in high risk situations working and but not getting the workplace protection that they deserve, and then now also not being put in first in line for vaccine.
And do you think that you went right into my next question, Doc? Should they be the next big priority in terms of getting the vaccines?
Absolutely. Just talking based on kind of my experience and what I've been hearing from the workers, they're really put in high risk situations, especially, workers who are above the age of 50. I'm hearing from truck drivers, for example, who are, 60 years old and driving to US and places like Texas where, the mask mandate policies are being lifted as more and more Americans are getting vaccinated. But these drivers are not being vaccinated in Canada. And then I'm talking, to the manufacturing, workers who have no paid sick leave and really no job security and are working in congregated settings, putting food on tables, but are not being prioritized in any way. And we're seeing that play out really in wave 3 and with the COVID variants.
So, Doc, I'll ask you a question that I've been asking a number of doctors over the past few days. If all of the healthcare experts like yourself are in agreement that this has to be the next big priority, why aren't governments following suit?
Well, I think it's really, in many ways, structural inequities, and it's a systemic, in many ways, I would say, a racial, a justice issue almost, I feel, because we know that, these precarious sectors are mostly new immigrants as well as racialized groups. So I really think it's almost in many ways structural racism and inequities that are being propagated during this pandemic and are impacting marginalized communities. So it's really high time that we prioritize them as well as provide them basic rights such as paid sick leave and job security.
So I was going to ask you about exactly that. So right now we have this immediate thing about the pandemic and the vaccines that needs to be dealt with, but it's opened up a discussion about a long-term issue, which is providing employment security and paid leave for people when they are sick, even in these situations where you don't have concrete unionized employment. What do you think of that?
Absolutely. I mean, I've been talking sort of about temporary agency work for a long time, and I kind of find it almost strange that it's not been discussed in, sort of even media as much, I would say. Like, these are workers who are waiting every day to be called to work by agencies, and they have been in these vicious cycles for years and years. And these are usually immigrants, new immigrants who are vulnerable. And so you could just imagine their vulnerabilities during this pandemic. And really, the economic uncertainty during this time has led to greater reliance on temporary agencies, whether that's manufacturing industry or also long-term cares as well. So, I mean, there's just so much to speak on this, and I can go on and on. But I really do think that temporary employment agencies need to be regulated because they are discouraging testing. They're discouraging isolation as well as vaccine uptake in many ways. These workers are migrating between factories, 2 to 3 factories within a matter of 2 to 3 weeks because they're being sent everywhere. And so I'm not surprised why places like Brampton, which are kind of the manufacturing hubs of Ontario, have been the epicenter, even though it has remained in lockdown since November 2020.
Dr. Brar, very, very quickly, if you were still that new young immigrant to this country working at the warehouse and we were in the middle of a pandemic, would you go into work?
Absolutely. There wouldn't be any option, right? Because I would be working for that $8 per hour at that time to put food on my table as well as my family's table, and there would be no other option because my work have been labeled essential, and I wouldn't have any EI or any other benefit to apply for.
Dr. Amanpreet Brar, warehouse worker, becoming a doctor, University of Toronto, joining us from Brampton, living that Canadian dream. Thanks so much for joining us.
Thank you.